Moving on to our next session, it's about, it's a very common question that how intermittent fasting. So we actually, all of us, some grade or some variety of intermittent fasting, everybody, every practitioner, panelist, and I guess everybody in the attendance also might be doing it. My next speaker is Dr. VIPUL YAGNIK. He's a well-respected faculty member at Banas Medical College and Research Institute in Palanpur, Gujarat. He has a wealth of experience in surgical science, education, and research, and has inspired many building professionals throughout his career. Dr. Yagnik has received fellowships from prestigious organizations such as Association of Minimal Access Surgeons of India, the Association of Surgeons of India, and Indian Association of Gastrointestinal Endosurgeons, and the International Society of Coloproctology. He has also landed into functional medicine and is helping his patients in understanding the root causes of their conditions. His topic for today is all about intermittent fasting. Over to you, sir.
Today's topic is intermittent fasting. I think, thank you for giving nice introduction. Here you can see there are two people doing their work, but they don't know what is there in between. There is an elephant in between and they are unaware that there is something wrong. So we'll see what is the problem. Next slide. So before we move on to the intermittent fasting topic, let's have some basic background why we are discussing this topic. So the important part is the insulin resistance, in which the intermittent fasting is the most powerful tool that helps you to reverse this condition, and what are the conditions associated with that we will look. Next. So what is the normal thing? In a normal cell, insulin helps the glucose to move inside the cell, and that will control the blood glucose. So when you eat, the insulin will rise. Glucose will rise, and that will lead to the rise in insulin to control the glucose. And that is how the glucose is controlled, and we don't develop hyperglycemia because of the normal functioning of the insulin. So the basic theory suggested behind insulin resistance are, one is underfilling theory and one is overflow theory, that we will look. Next slide, please. So what underfilling theory suggests? Underfilling theory suggests there is a problem with the insulin receptor site. So the insulin receptor is dysfunctional, and that will not allow glucose to enter into the cell. So in that case, even though there is a low glucose inside the cell, but still glucose is not able to make inside the cell. So basically is an internal starvation paradigm. So if suppose this theory is right, then there shouldn't be fatty liver. Instead of obese patient should be skinny, and that condition should not be reversible with weight loss. Solution in that situation would be give more insulin. Next slide. So do you think this is a cellular starvation? This is not a cellular starvation. So obviously that theory is not acceptable theory. So we'll move to the next theory, that is overflow paradigm. In case of overfilling theory, the insulin receptor site is perfectly normal functioning. So that will allow glucose to enter into the cell, and cell is filling with the glucose. So once the cell become overloaded with the glucose, they will not allow further glucose entry, and that is how hyperglycemia will develop. In that condition, patient will develop a fatty liver, obesity, and that is reversible with the weight loss. And solution in that situation will be the reduction in the glucose, fasting, and low carb diet. So that is more acceptable theory. Now in traditional model, what people believe is insulin resistance is the primary problem that leads to the hyperinsulinemia and ultimately the beta cell failure. And beta cell failure will lead to the type 2 diabetes. But what new model suggests is hyperinsulinemia is responsible for the insulin resistance, not hyperinsulinemia is.
But your audio is a bit low. Can you please move the microphone towards your mouth?
Hello, now it's fine.
Yeah, not that clear, but yeah, can you please start to speak so that I can comment?
So the new model suggests that hyperinsulinemia is the primary problem. As we all know, for antibiotic resistance, antibiotic is responsible in similar way for insulin resistance, the persistent high level of insulin is the responsible. Next slide, please. So what are the conditions that is associated with the hyperinsulinemia? So there are myriads of condition that is associated with the hyperinsulinemia, primarily obesity, hypertension, non-alcoholic fatty liver disease, obstructed sleep apnea, impaired glucose tolerance, type 2 diabetes, cardiovascular diseases, some cancers, dementia, stroke, Alzheimer disease. The condition non-communicable disease, most of the non-communicable disease are associated with hyperinsulinemia. You name the condition, you will find there is a raise in the insulin level that is responsible for that condition. Next slide. So most of the time we come across the obese patient and they have been taught that you are consuming more calorie as compared to your burning calories, and that is the reason why you are obese. And the reason for insulin resistance also proposed like in that manner. But if you look at the first law of the thermodynamics, in first law of thermodynamics state that calorie or energy cannot be produced or cannot be destroyed, it can only be shifted. So in a calorie equation, body fat is equal to the calorie in minus calorie out. So suppose if we decrease the calorie intake, that equation will be balanced by decreasing the calorie output. Means your resting energy expenditure will decrease. So your body will reduce the BMR to compensate for that formula. And if you suppose decrease in calorie expenditure will lead to the reduce in BMR. If you suppose do exercise more, then you will feel more hungry and that will compensate this phenomenon. So that notion is not most of the time correct. Second thing is, in this equation, it suggests that if you consume a calorie, 100 calorie from a ice cream and 100 calorie for broccoli, both are same. But people forget that our body doesn't have a receptor for calorie. Our body will respond to whether we consume carbohydrate, we consume fat, or we consume protein. If you see, the most glucose response is with the carbohydrate and least response is with the fat.
So we cannot hear you. Can you please check on your earphone device? Can you hear us? No, we cannot hear you. Can you please check your audio?
Now it's here.
Yes, very clear, very clear. Yes, thank you so much.
So what are the strategies that help in reducing the insulin level? So there are three powerful strategies by which you can reduce level of insulin. First is fasting, second is exercise, and third one is diet. Next slide. So today's topic of discussion is intermittent fasting. After giving this background, so fasting literally means the period when you don't eat rather than period when you eat. So when you fast, practically you are decreasing your glucose level. If glucose level is low, then insulin will be low to compensate for that. So there are six different type of fast that is popular. Most popular fast is 16-8 fast. Means the fast eating window of 8 hours and fasting window for 16 hours. Second popular fast is 5-2 fast, in which the people used to eat regular diet for 5 days, and there is a reduction in calorie around 500 calories for a 2 days. Alternate day fast is there, in which people fast for 1 day and regular meal on a next day. There is a warrior diet in which there is a fast during day and large meal at a night. Some people follow eat, stop, eat, fast for 24 hours once or twice a week. There is a spontaneous meal skipping. So these are the various type of intermittent fasting. Some other type of fast are also suggested. Suppose there is a water only fast. So some people take only water during that period. So practically speaking, anything more than a water will take your fast. But some people take fiber fast, some people use fat fast, some people take coffee fast, tea fast. So there are various type of fast are there, but practically these type of fast, although they are not strict fast, but they definitely have a metabolic advantages. So to sustain a fasting period, they can be allowed to take some fluid that we will discuss later, which are the things that allows in an intermittent fasting. Next slide, please. Next slide, please. So which are the people that should not follow intermittent fasting? Undernourished people or malnourished people for obvious reason should not be follow the intermittent fasting schedule. Those who are less than 18 years should not fast. Pregnant and lactating women should not fast. Those who are having gout, they should not fast. And those who are having GERD should also avoid fasting because of the aggravation of the reflux. Some people have a aggravating gastroesophageal reflux on fasting. Gout, because sometimes fasting schedule may lead to hyperuricemia. So they are also not advisable to do fast. Pregnant and lactating women, because of their nourishing requirement, they are not allowed. Children less than 18 years are not allowed because of their growth period. And undernourished and malnourished, for obvious reason, they should not fast. Next slide, please. So what are the advantage of fasting? Basically, one thing we should keep in our mind is fasting is not a diet. Fasting is a protocol. So one thing you can do, it can be combined with any diet, whether it doesn't make any difference whether you follow paleo diet, whether you follow your vegan, whether you are following keto diet, it can be combined with any fast. It's a flexible type of plan. Flexible type of plan means on one day you can fast, on other day you can have a regular meal. Suppose you are going to some party and you are not taking cake or you are not taking ice cream. It's not good looking for the other people. So you can take. So that is a flexible type of fast. Third thing is anybody can do that fast. It can be done at any time. Anybody means even rich can also do, even poor can also do, because the money is not involved. Grocery buying is not involved. It is simple and convenient. Simple because you need not to explain anything to the patient. Just say you you are not advised to eat, so don't eat. That is the only thing. Is a convenient because anybody can. That is a natural way to bring the sugar down. So there is no synthetic product, no product involved, no supplements. So in that case, it's a natural way to bring the sugar down. So what are the common myths associated with the fasting? First myth associated with the fasting is it puts your body into starvation. Second myth associated that it burns your muscle. Third myth associated is that it lowers your blood glucose level. Fourth is it makes you overeat. And fifth thing is deprive you from the nutrients. Now, among these myths, there are two common myths that I would like to address. First thing is it burns the muscle. Many people think if you fast, it will burn your muscle. But it's not like that. If you search in a scientific literature, fasting is associated with a lower level of insulin. Once the insulin level is low, the counter-regulatory hormone will be on the rise. So which are the counter-regulatory for the insulin? Are growth hormones is a counter-regulatory hormone. Adrenaline, noradrenaline is counter-regulatory hormone. So growth hormone is the hormone which requires for the growth of the muscle. If suppose your growth hormone level is high, then it's very difficult that you will lose the muscle. And if your noradrenaline and adrenaline level is high, that will gives you energy to do more exercise and to strain your muscle. Because the only thing which is associated with the muscle is you put the muscle under strain. If you put a muscle under strain by doing a weight exercise, weight lifting, then muscle will definitely grow. So adrenaline, noradrenaline, and growth hormone has an advantage and will spare the muscle from burning. So fasting will not burn your muscle, that you should keep in mind. Second myths associated with the fasting is it lowers the blood glucose. So as far as you are not diabetic, your blood glucose will never goes down to that point that you become a hypoglycemic. The reason behind that is Once your glycogen store is depleted to supply the glucose, the body will have another known as gluconeogenesis. Once gluconeogenesis comes in the picture, that will supply the glucose. Gluconeogenesis is basically a production of glucose from the non-carbohydrate sources. Non-carbohydrate sources are either fat or protein, but the preferred source is fat because that is an abundant energy source in the body, and the body prefers fat over protein. So protein will not break down. Even if suppose there is a requirement to break down the protein, that will take a protein from the cartilage, will take the protein from the skin, take the protein from the collagen, but not take protein from the muscle unless it's a life condition. So these two myths should be, sometimes even you are fasting and also the blood glucose may rise, and that effect is known as Somogi effect. Somogi effect is at the time of morning, your cortisol level is on the rise at around the 5 a.m. So suppose if that cortisol will going to raise your glucose level. So even if you are fasting, your glucose is under control. Those who are diabetic are advisable to follow this type of schedule under supervision because their glucose metabolism is not proper and they may have a possibility to develop hypoglycemia. So it's better they will do intermittent fasting under supervision. Next slide, please. What should you know at the start? Because the problem associated with intermittent fasting, those who are indulged in intermittent fasting, they might encounter some problem like headache and dizziness, constipation, sleep disturbance, heartburn, blood glucose issues. So headache, why the patients develops headache? Why, back slide please. Why the patients develop headache? Because as you fast, the level of insulin will become low. And if insulin is low, the main function of insulin is to reabsorb the water and salt. So you need to urinate more if suppose insulin is low. So you have seen type 1 diabetic patient. Type 1 diabetic patient say having a polyphagia, polydysplasia, polyphagia. In that case, the patient used to urinate more. So more water loss will lead to the dehydration. Dehydration may lead to the headache. Sometimes such a huge amount of water loss can lead to the, along with water, sodium follows. So there may be hyponatremia, and the reason for headache and dizziness is the hyponatremia. And in that case, simple taking some salt, adding some salt in the water will helps to overcome this problem. Constipation, obviously, as you are eating less, that means it's the constipation. If it's not a troublesome, it's not giving you discomfort, then it's okay even if you go once in a 2 or 3 days. But if suppose it's a discomfort, you can add fiber in the diet or you can take some laxative. Sleep disturbance, the reason behind sleep disturbance is the counter-regulatory hormone because noradrenaline and adrenaline are on the rise because of low insulin level and that may disturb your sleep. Heartburn is because of the raise in the production of acid in the stomach will lead to the reflux and that will lead to heartburn. Blood glucose patient may develop hyper or hypoglycemia sometimes, those especially those who are diabetic. Next slide, please. So what are the tips for successful fasting? First thing, fasting doesn't give you liberty to eat. That thing you should keep in mind. So always keep that thing in mind. Do not overeat. Eat normal meal. Avoid dehydration. Always stay hydration. The fluids which allowed in the fasting is water, green tea, black tea, coffee, herbal tea. These are the allowed in the fasting. But again, this coffee, black tea, green tea, because of their caffeine content, they are dehydrating fluid. So always it is advisable to stay hydrated, take a plenty of liquid. Third step is ride the hunger wave. What it means by riding the hunger wave? Because we have a ghrelin hormone and ghrelin hormone is an hunger hormone. They follow a pulsatile pattern. Once ghrelin level is rise and it takes 45 to 90 minutes to come down. So once if you pass that time, then you will don't feel happy. So you will require a strong motivation in that case. So one of the ways by which you can write the hunger ways is stay busy. Suppose at your breakfast time, at your lunch time, at your dinner time, if you want to skip some meal, you can stay busy at that time. And one of the most important advice I usually to my patient is don't tell that you are fasting to anybody, because people always try to discourage you. If you fast, you will lose the muscle, you will have a nutrient deficiency and all things. So the people get demotivated. So my advice to my patient is don't tell anybody that you are fasting. Give a time. It usually takes some time to adjust yourself to a new schedule. So you have some discomfort in the initial period, but as the time passes, it goes away. Take a nutritious diet, because as you are fasting and your eating period is limited, so it is advisable to take a nutritious diet to avoid deficiency, and don't compromise. Don't compromise means you can take a nutritious diet and have enough food, but keep that thing in mind. Suppose if you are doing a fasting for weight loss, it's always advisable to take a sub-calorie diet rather than isocalorie diet. So you have to reduce some amount of calorie, not same amount of calorie you can consume. Next slide, please. Next slide, please.
Yes, 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 sir.
So nowadays there are some new concept emerging. Initially, the fasting is advisable. You can do anytime. You can advisable. Nowadays, there is a protocol known as early time restricted feeding, early fasting versus late fasting. So there are ample of studies available in last 2-3 years. This is an important study published in Nature Communication in 2022, which is a randomized control trial. Randomized control trial is one of the top level study that can be published in a journal. So it's a randomized control trial for time restricted eating in healthy volunteers without obesity. So you see that early TRF, early time restricted feeding, is found to be more effective as compared to mid time restricted feeding in improving insulin sensitivity. On above that, it will improve your fasting glucose, reduce total body mass and adiposity. It reduces the inflammation and increase gut microbial diversity also. So although every type of fasting helps in one or other way, but early fasting or early time restricted feeding, early means you should start somewhere around 10 a.m. and you can continue up to 4 p.m. That is advisable to improve your metabolic parameter. Like, so this is a second study published in 2023 in the Journal of Clinical Endocrinology and Metabolism, which also have a same finding, is basically a meta-analysis. Meta-analysis is even have a more value as compared to the randomized control trial. It is the highest level of evidence possible in the medical literature, because it's a systemic review of the systemic review. So that is the highest level of evidence you can get. That also point towards the early time restricted feeding is better as compared to the mid or late time restricted feeding. The reason behind the early time restricted feeding helps in improving metabolic parameter is we have a clock gene in our body. So clock gene works according to the circadian rhythm. And in circadian rhythm, the beneficial genes for metabolic functions, those are more expressed in the early time as compared to the late time. So because of that, early time restricted eating is found to be more beneficial as compared to mid or late time restricted feeding. So it is advisable those who are struggling with the metabolic dysfunction, they are advisable to take early time restricted feeding protocol. Second reason given is the cortisol, because cortisol also following a circadian rhythm. It's the highest in early in the morning and lowest in the late in the evening. So early eating will also helps cortisol to maintain that homeostasis. In that way, they helps to ameliorate the metabolic dysfunction in a faster way. Next slide.
So the 2 minutes to go, sir. Yeah.
Okay. Avoid dehydration. So these are the fluids allowed. I think already we have discussed. Next slide. So over at the hunger wave, I think already we discussed the ghrelin level has a spike, and that spike you have to be stay busy to avoid that spike. Once that spike has passed, then you will not feel hungry. Suppose if you are doing some work and you feel your time lunch time is one, but you are so busy that time has gone to 3 o'clock. At 3 o'clock, you will not feel hungry because the ghrelin wave has already passed. Next slide. The fasting, as you become adapted to the fasting, gradually the ghrelin levels will fall. Next slide. So ghrelin level and meal time. Next slide. Stay busy. Is calorie restricted diet same as fasting? Next slide. If you follow a calorie restricted diet, you take a 500 calorie instead of 200 calorie, but it divided into various like breakfast, break, lunch, snack, and dinner. Then you will have a persistent high level of insulin. So your body will not have access to the store of 500 calories fat. So the metabolic rate will come down in a calorie restricted diet. Next slide. If you follow intermittent fasting, so insulin level has variation. So if you take a meal, insulin level will rise. But suppose if you take a direct dinner, then in between there is a low level of insulin. Low level of insulin, so the increase in the glucagon level, and that allows the mobilization of the fat in between. So the metabolic rate will not come down. Metabolic will rate same. Next slide.
Sorry to interrupt you, sir, but the time is up. How many more slides?
I think 2 or 3, not more than that. So simple, how to break a fast. So do not overeat. Plan some pre-meal, small meal followed by a large meal with some amount of fiber at the time of breakfast. At the time of breaking fast, you can take a psyllium husk and avoid simple carb to break a fast. Use either protein or fat to break a fast. Next slide. Benefit of fasting is it improves the insulin sensitivity, improves the autophagy, it promotes the lipolysis, and it causes the brown adipose tissue activation. Next. So ultimately, the elephant is insulin resistance. Next slides. And so moral of the story is keep your insulin as low as possible, control your carbs, prioritize protein, fill with fat, protect your liver from sugar, and feed your gut with fiber. And fructose is the worst type of sugar. Next slide.
There's
Thank
one
you.
more slide. Thank you. Thank you so much, sir, for sharing your insightful views on intermittent fasting and insulin resistance and how it can help in most of the metabolic conditions and other chronic conditions inside the body as well, as it can heal. It has the property of healing. There are a few questions in the chat box. I request you to stay back and please answer those questions in the chat box itself, as we are running out of time. So we'll move to the next speaker. Thank you so much for joining us, Dr. Vipul. Thank you.
Thank you. Thank you.